Goniometric measurement for hip adduction. Normal range of motion 0 to 30 degrees. Testing position. Place the subject in the supine position with both knees extended. Scoot them close to your side of the table. And abduct the contralateral extremity to provide sufficient space to complete the full range of motion in adduction. Make sure the hip being tested is in 0 degrees of flexion, extension, and rotation. Stabilize the pelvis to prevent lateral tilting. Adduct the hip by sliding the lower extremity medially toward the contralateral lower extremity. Place one hand at the knee to move the extremity into adduction and to maintain the hip in neutral flexion and rotation. The end of the range of motion occurs when resistance to further abduction is felt, and attempts to overcome the resistance cause lateral pelvic tilting and pelvic rotation or lateral trunk flexion. The normal end feel is firm. You center the fulcrum of the goniometer over the ASIS of the extremity being measured. Align the proximal arm with an imaginary horizontal line extending from one ASIS to the other. Align the distal arm with the anterior midline of the femur using the midline of the patella for reference. Get your beginning measurement. Take the patient to end range. Repalpate your landmarks. And realign your goniometer and get your end measurement.